Even though we have unprecedented times going on right now, with the biggest health crisis we've ever had in our lifetimes, there still are a lot of people that have had a knee replacement just prior to this pandemic. And at this point, those patients are at home trying to go through their post-operative rehabilitation period. What I've tried to do today is try to outline some things that you can do at home to make sure that you continue to progress with your recovery. And these are things that I commonly discuss with my patients both preoperatively and postoperatively. You should definitely keep in touch with your surgeon and your surgeon's office to make sure that you're doing things that are within their protocol. But hopefully, this answers some of the questions that you might have in these next few weeks as access to healthcare has been limited for patients that are not sick with COVID-19. Now, unfortunately, when it comes to total knee replacements, this is one of the more painful operations that we do in orthopedics. And even with the preoperative blocks and cocktails, a lot of patients will still have pain, especially for the first few weeks. It's really important to try to keep that pain under control, and I strongly encourage you to talk to your surgeon and your surgeon's office to find out what protocols they have in place and what things might be safe or not safe for you to take, depending on your medical conditions or other medications that you're taking. Now, just to summarize what I do with my patients is we typically have them on a pre-op cocktail in the hospital, and at home they'll continue on a scheduled acetaminophen, which is the generic name for Tylenol. They'll be on this around the clock, typically every 8 hours, which helps prevent peaks and valleys. In addition to the Tylenol, what we'll also use is an anti-inflammatory, typically a prescription anti-inflammatory, which has a lower risk of bleeding when compared to over-the-counter medications such as naproxen or ibuprofen. And then for the first week, we'll also use a prescription medication, which helps decrease nerve sensitivity. Now, after all of that, I'll have patients use only for severe breakthrough pain a prescription opioid, and typically they'll only use these for the first 2 or 3 days. Now, there are some people that will have pain which is greater than this, and they may require different medications or higher doses or opioids for longer periods of time. But definitely consider the use of scheduled non-narcotic medications such as acetaminophen or anti-inflammatories if they're not contraindicated for you. Now, one very simple but sometimes overlooked thing that can help a lot with pain is icing after surgery. Now, you do not need to have a special ice machine, but I find that if patients do spend money on an ice machine, they're more likely to use it just because they've invested in that product. In any event, any ice that you have in the freezer or any cold packs that you use can be helpful both to decrease pain as well as inflammation and swelling, and they're a great adjunct to medications to decrease some of the pain associated with total knee replacement surgery. When we talk about swelling, there's really two main aspects of swelling that I see after total knee replacement in my patients. Now, there can be whole leg swelling. This can be predominantly in the foot and calf, occasionally in the thigh, and in certain individuals, this is concerning for a potential blood clot. If that happens, the only way to truly diagnose a blood clot is by getting an ultrasound. So if you're having full leg swelling that's not getting better with rest and elevation or causing exquisite pain, definitely contact your doctor's office to determine whether or not an ultrasound should be performed. But now the other more common place that I see swelling is in the knee itself. And the analogy that I like to use, which I think makes sense to people, is that the knee is actually a bag, what we call the capsule. And like a clown that blows up animals with balloons, those balloons, once you stretch them or blow them up a few times, they're a lot more elastic and they will stretch out more easily. So the same thing happens after knee replacement. If you do develop swelling, or maybe you were one of those people that had a lot of swelling prior to surgery, that capsule may be more elastic or stretched out. Now, what I have my patients do if they suffer from that type of swelling is I have them every morning when they get up or after they get out of the shower is wrap it with an ace wrap or a knee sleeve. Take that knee sleeve off before you go to bed. And you may have to do this 7, 10, 14 days in a row to help that swelling get under control and allow that capsule to shrink back down. And this would cause less long-term swelling. And also, sometimes it improves range of motion because a lot of patients will tell me that they had a hard time getting deep bending or straightening when the knee was full of fluid, which typically is blood after the knee replacement surgery. And this will usually resolve over time, but if you can help it out by reducing the swelling that you're getting each day, you may speed that process up, and this may aid in your recovery. Range of motion is so important. This is one of the most important things that I talk to my patients about. And the way that I describe it is that although you go through a long recovery phase and you can work on strength and stamina, the first 6 or 8 weeks are basically the only time that you have to gain full range of motion. And I find that a lot of patients that get full range of motion earlier and sooner all tend to have less pain and a shorter recovery. I try to set a standard with my patients that when they leave the hospital, their knees should be able to easily bend at a 90-degree angle, and that's sitting comfortably in a chair with the foot flat on the ground. Every 2 weeks, there should be an interval of 10 degrees. So by the second week, patients should be at 100 degrees of flexion. By the fourth week, you should be at 110. And by 6 weeks, you should be at 120. Using that as a guide, it should help you achieve those range of motion goals. Similarly, straightening is very important also. So you want to make sure in the first week or so, you might have a slight bend or what we call a flexion contracture. But as the hamstring stretches out and as the swelling decreases and the pain improves, you should be focusing on getting full extension or what we call 0 degrees. And sometimes by that third or fourth week, as that straightening occurs, you'll find that your gait and your walking ability will all improve. The dreaded night pain. I don't know of anybody that truly has a very clear scientific answer as to why patients get night pain after total knee replacements, but it's a very, very common complaint. Some patients get night pain prior to surgery just from their arthritis, so this isn't a big change from what they've been living with. But for patients that weren't used to having night pain prior to surgery, having night pain day after day, week after week, can be very alarming. Now, my belief is that a lot of it does not have to do anything with the nighttime, it being dark out, or your bed or your sheets. More commonly, it's due to the fact that you're not moving your knee. Take, for example, in the middle of the day, if you sat in a chair and didn't move for 2 or 3 hours, you would start to get pain in your knee and feel that urge to get up, stand up, walk around. And during those first couple weeks, what you may find is the knee will wake you up and it will be stiff and it will be sore and it will be achy. Just understand that this is common and it will go away. There's no clear treatment that makes it go away quicker or faster, but there's a few things that I've learned over the years that my patients have found to be helpful. Number one, motion is key. Patients that get their range of motion sooner and earlier and faster all tend to find that in addition to their motion getting better, the night pain does go away. It's also extremely important to have what we call good sleep hygiene. And what that means is waking up at the same time every day, going to bed at the same time every day, not using electronic devices like your phone or tablet in bed, and even more importantly, for an hour or two before you go to bed, as sometimes it makes your brain believe it's still daylight out. Some patients have tried to use over-the-counter remedies such as melatonin. These are things that you can try if there's not a contraindication to using them for you. And also, more importantly, is making sure that you're not napping during the day. Now, some other tricks that patients have used, which can be helpful in some people, is a lot of the over-the-counter ointments and salves, the capsaicin-style products, icy hot Tiger Balm. I've had some patients tell me that by rubbing it on the back or the sides of the knee, not directly over the incision, that it helps distract the brain and allows them to get some sleep throughout the night. But just understand that if you're suffering from having some sleepless nights after knee replacement, you're not alone, and it will go away with time. Now, there are a few other things that are very common after total knee replacement surgery, and patients can get alarmed by them. Just understand that these are things that are quite common. So number one is warmth. It's very normal in the first few weeks for your knee to feel warmer or even look more swollen and sometimes red when compared to the other knee. Now, there's a very big difference between a little warmth, a little swelling, and a little redness compared to the severe warmth and redness of an infection. So that's where it's really helpful nowadays. If someone's very concerned, we can have people send a picture to take a look or bring them in if there's a high suspicion of infection. But just understand that when your knee feels warmer than your other knee, that is very common. The second common thing that a lot of patients notice or complain about is numbness on the outside, or what we call the lateral aspect of the knee. When you make an incision over the front of the knee for any surgery, such as a kneecap fracture or a tendon rupture or a knee replacement, there are little nerves that we can't see called the geniculate nerves, and these all run from the inside of your knee to the outside. They do not control any major muscles, but they do control the sensation to the skin, so it's very common to have some numbness on the outside half of your knee. And for some people, this can be permanent. It will start out quite large, and over time it gets smaller, Not that those individual nerves grow back, but just imagine, for instance, if you had a large tree and you cut down a large tree branch. You know that one large tree branch won't grow back over time, but the other larger branches around it will have smaller branches and leaves fill in that gap. And that's typically what we believe happens on the outside part of the knee as that sensation starts to come back. But patients may also notice occasional shooting pain or little what they describe as zingers, and that most likely is some of these nerves starting to come back or regenerate. And the last thing that a lot of patients get alarmed or concerned about is clicking. In a normal knee, you have cartilage rubbing on cartilage. So there's very little to no sound when they touch one another. It's almost like banging two wet sponges together. But in an arthritic knee, people have become accustomed to hearing cracking, grinding, popping, or crunching. In an artificial knee, the surfaces that rub on one another are metal and plastic. So if you took a plastic pen and you banged it on a piece of metal and you hear or feel that click, that's commonly what happens inside the knee. So as you bend and straighten the knee, especially in the beginning when your knee's more swollen, and those surfaces are separated even by a millimeter and then touch, you may hear or feel a click. Just understand that is normal and common. I really hope that you've found this information helpful and useful if you're currently at home recovering from knee replacement during this coronavirus pandemic. If you go to my website, you can find more information and more videos. There's also a link that you can find under the patient forms, which gives you my 1-month total knee handout in a written format of all the common things that patients will see in the first month. In the meantime, stay safe, stay home, take care, and thanks for listening. I'm Dr. Adam Rosen.